In a room much like this one, our first story tonight takes us on a medical journey to the Taborian Hospital in Mount Bayou. It opened back in 1942, where the entire staff, including doctors and nurses, were black. 12 News reporter Leah Williams traveled to the Delta community founded by former slaves, where numerous people received medical care.
The Taborian Hospital was built by the International Order of 12 Knights and Daughters of Tabor, a black fraternal organization. Its chief grand mentor for the Mississippi jurisdiction, P.M. Smith, was inspired by the state's first hospital for black patients, the Afro-American Sons and Daughters Hospital in Yazoo City that opened in 1928. Smith was determined to build a similar hospital in the Mississippi Delta.
So he went to his organization and said, "This is my strategic plan. Let's do this." And they said no. So he was undaunted. He said, "We're going to continue to go back and ask this organization." After about 10 years, they said, okay.
Member donations funded the $100,000 in construction costs, and on February 1st, 1942, the Taborian Hospital opened its doors in Mount Bayou.
During that time, I was a little girl, born in 1948. We didn't have to go very far to come to see the doctor. It was right here in Mount Bayou community. And most of us, we had to share crops, and we did chopping and picking cotton. And so just to come uptown from where we was living at, the hospital was right there.
Black Mississippians were often denied adequate access to health care, which is why Smith pushed for the new hospital.
There's the story of the 6-year-old who was in the backyard burning trash, and her dress caught on fire, and she was burned terribly, and her parents took her to a hospital outside of Mount Bayou, Mississippi. At this hospital, they were told to go into the basement, where it's very dark, where it's very cold, and wait on the doctor to come down after he's seen his patients. So think about this 6-year-old who's burned very badly and waiting. She died.
The Taborian Hospital had 42 beds and 2 operating rooms where tens of thousands of black patients were treated from all over the country.
During that time, people was coming from everywhere to see the doctor. And my mother was here. My mother was one of the nurses.
Members of the Knights and Daughters of Tabor were able to pay into a system similar to today's health maintenance organizations. Members were guaranteed a certain number of annual doctor visits. Non-members were also treated for a higher cost.
An organization, and the organization that they were members of, they would have to go to see the doctors so many times a year, not because they were sick, but to provide them service to make sure that they stayed healthy.
Not only were patients able to get fair treatment, but many were also seeing representation in the medical field for the first time since it was an all-black staff.
And health equity is important, but to see something that you could be, the children could be, to be doctors, to be nurses, that was very important.
Dr. T.R.M. Howard was the chief surgeon at the Taborian Hospital for 5 years. Herman Johnson Sr. worked directly under Dr. Howard in the late 1940s and says keeping the doors open was always a challenge.
They were saying that the rooms were too small, and some other things they were saying that we'd have to increase and do better. Now they had hospital in Shelby run by white doctors, worse shaped than this one, but they stayed open.
The Taborian Hospital closed in 1983 due to a lack of funding. It was restored and reopened as an urgent care clinic in 2016, but closed again. With rural hospitals statewide still facing financial issues today, Mount Bayou residents hope to see the Taborian Hospital open its doors again one day.
It would be good if we could get this hospital back open again, but it's good to see it's still standing. And it's being taken care of.